in dengue, the platelet counts are lower to a very large extent compared to Zika virus, and Zika virus is usually a milder infection and occurs more commonly in children and young adults. So only paracetamol with adequate amount of hydration and rest for 3 to 5 days is usually sufficient to manage this disease. We should avoid cooling of water in our neighborhood or in our vicinity. Use mosquito nets as much as possible. Isolate the patient who is already suffering from such disease so that the disease is not transmitted and the chain of transmission is broken.
Hi guys, this is Minidevan and you're watching HealthSite.com. With the rise in the number of cases in Zika virus currently going around, we have with us today Dr. Puneet Khanna, Head of Respiratory Medicine, Manipal Hospitals. Hi doctor, how are you?
Hi, good morning. How are you?
I'm great, sir. So the very first question that comes to my mind right now is, what exactly is Zika virus, if you could throw some light for all our viewers?
Okay, so Zika virus is a viral infection that is very commonly transmitted through mosquitoes, and it's prevalent during the monsoon and after monsoon. It's quite common in our subcontinent because of the prevalence of other vector-borne diseases or mosquito-borne diseases. And Zika virus also is just like any other infection or a mild viral infection that you get with the similar symptoms like fever, chills, vomiting, and a little bit of body ache and joint pains, and in severe cases, rashes and neurological complications. But it's a viral or what we call a group of viral arthropod-borne viral infections which are transmitted through mosquitoes.
Okay, so sir, how can one really differentiate Zika virus from dengue?
Yeah, so symptom-wise, it's very difficult to differentiate between the two. There are serological tests available that can differentiate. Sometimes it is said that in dengue, the platelet counts are lower to a very large extent compared to Zika virus, and Zika virus is usually a milder infection and occurs more commonly in children and young adults. And also the recovery also is faster with Zika virus compared to dengue and the other vector-borne diseases. Also, it's quite rare to get pneumonia because of Zika virus or a multi-organ failure, although it is not uncommon. But yeah, it's like there are very few cases compared to malaria or dengue as such.
Okay. तो सर, अगर किसी को हो गया है Zika virus, if somebody is suffering from Zika virus, पहला step क्या होना चाहिए उनके लिए? What should they do to sort of treat it, or should they rush to the hospital, or घर पे ही can it be treated?
Yes. So like I said, most of the cases of Zika virus are self-limiting mild diseases. It is not very severe. So only paracetamol with adequate amount of hydration and rest for 3 to 5 days is usually sufficient to manage this disease. There is no need for antibiotics because they are not effective in this particular disease. However, if the patient doesn't respond to these symptomatic over-the-counter medications in 3 to 5 days, then they should go for their blood test and serological test to confirm, and then go for assessment organ-wise whether they are heading towards any multi-organ involvement. Usually, such kind of infections are very stable and easy to manage in children and young adults who do not have any previous history of any illness. But if you have elderly or those who are immunocompromised or suffering from any other disease, then they should immediately rush to get a medical help so that they can adequately cover this.
Also, it's commonly observed that Zika virus is currently on a rise. Is it true? What are the status of the cases in India specifically right now? And if it's on a rise, then what's the specific reason for this?
It is true that Zika virus reporting has increased in last few years. There are a couple of reasons for it. Number one, we are now identifying many of such diseases as correctly as Zika virus, whereas previously many of these diseases were just labeled as viral fevers or sometimes mistaken as dengue or malaria and treated as such. So now, because the diagnosis has increased, so we are hearing more about it. The second reason is the urbanization and migration of large amount of population to cities has led to increase in the prevalence of mosquito-borne diseases. And particularly after monsoon, the mosquito-borne disease increases in our areas or in our countryside. So these kind of increases the incidence also of infection. But like I said, most of the diseases are self-limiting. Yes, but it is true that the incidence is rising.
And sir, any prevention tips that a person can keep in mind in order
Yeah,
to
it's
stay?
absolutely same as that of dengue, that we should avoid cooling of water in our neighborhood or in our vicinity. Use mosquito nets as much as possible. Isolate the patient who is already suffering from such disease so that the disease is not transmitted and the chain of transmission is broken. These are the only precautions. Breeding of mosquitoes should be checked and should be adequately addressed. And then take medications properly. Don't get panicky, but timely medications should be taken for this disease.
All right. I think, sir, this has been fab, and the audiences will go back home with lots of valuable insights. So thank you for that.
Thank you. Thank you.